Hi, my name is Jessica Lebo. I'm a physician assistant here at the Inova Schar Cancer Institute. This information can help you prepare for your day at the Infusion Center so you know where to go, what will happen, and what to expect. When you sign in at the Infusion Center, the registration staff will give you an armband. You'll have to verify your name, address, and date of birth. Please make sure to wear the ID bracelet the entire time that you're here. Have a seat until the clinical team is notified you're here and ready for you. A clinical technician or nurse will come to the waiting room, call your name, and you'll go to the check-in area. A lab technician will draw your blood and get your vitals before you begin treatment. We'll want to know how you're feeling and how well you're tolerating treatment. Then you'll be taken to your infusion chair for your treatment. The infusion room is outfitted with recliners in open areas and also some private rooms. Private rooms are assigned based on medical necessity and type of treatment. Before treatment begins, the nursing team will review lab results, vital signs, and other information. Our pharmacy team reviews your labs and performs a final safety check, and the medication is prepared. Once the medicine arrives on the infusion floor, 2 nurses will come to your infusion chair to do another safety check and begin your treatment. Once infusion starts, you will have to stay within the infusion suite. The amount of time it takes for your infusion visit depends on your treatment. Your IV pump runs on a battery, so you can unplug it if you need to use the restroom, and it can be plugged back in just like a regular power cord. If you need help getting to the restroom, the clinical tech or nurse will be able to help you. Once your treatment is complete, a nurse or provider will unhook your infusion. Your infusion bag will be removed, and the port and area of your body where you received the treatment will be cleaned before covering it up. In some cases, you may have to go to the lab, as directed by your doctor, before your infusion visit. If that's the case, please keep in mind that before your treatment begins, the nursing team will want to review your lab results. It's good to know that if your labs are drawn the same day as infusion, it takes between 20 and 45 minutes until the results are available. In the event of an abnormal lab result, the infusion staff has to contact your doctor to decide whether to proceed with your infusion. To minimize time spent waiting, ask your nurse about whether you can have your labs drawn 2 or 3 days prior to your appointment. When you check out, the registration staff or your nurse will give you a copy of your upcoming infusion appointments. We will usually schedule 2 to 4 additional treatments depending on your treatment plan. Appointments are not scheduled further out, as treatment plans can often change or be delayed. You can also see upcoming appointments on the Inova MyChart system. You can set up a MyChart account by going to mychart.inova.org. Using MyChart, you can also see lab results and send messages to your clinical team. If you have questions or need to reschedule your appointment, please call your infusion center or your healthcare provider. We are here to support you every step of your journey.